Hello, welcome to the second interview on the impact of COVID-19 today on gender equality. My name is Mafalda Infante. I'm Unite's head of parliamentary engagement. And as mentioned yesterday, these two interviews are happening within Unite's participation in the WHO campaign advocating for a safer, healthier world, safe from pandemics. Today, we are lucky to have Honorable Esteban Paulón, Member of Parliament from Argentina, and Angela León Cáceres, Global Coordinator at Women for Global Funds. Welcome and thank you for joining us. So before we go to the questions that I have prepared for you, I wanted to ask you, both of you, if you could briefly introduce yourselves and the work of your organization. In the case of Angela, maybe Angela, we can go first to you.
Sure. Thank you so much. And it's a pleasure to be here with you in the interview, specifically in this current important time around the World Health Assembly. I'm Angela León Cáceres. I'm the Global Coordinator of Women for Global Fund. And we are a global network of advocates for gender equality. And we are present around 72 countries specifically, and mostly in the global south. We are around 350 advocates of women and girls in all of our diversity. And we are dedicating our efforts and our advocacy to making sure that projects from the Global Fund are gender sensitive and transformative, and that address the needs and women of girls in the diversity. We believe on the importance of women empowerment with an emphasis on the youth specifically, and we try to facilitate and advocate for a meaningful participation and engagement in key decision-making processes around the systems of global health. And we always try to influence policies with evidence-based advocacy, and we are fostering accountability and hopefully improving the health and well-being of all, specifically addressing the most urgent needs around HIV, tuberculosis, and malaria, which are the current epidemics and pandemics that we still need to fight, and that disproportionately affect women and girls in the countries. Thank you so much for having me here.
And thank you so much for joining. MP Esteban Paulón, go ahead.
Thank you, Mafalda. Thank you, Unite. My name is Esteban Paulón. I'm National Deputy in Argentina since December 2023, representing Santa Fe Province and Socialist Party. For more than 20 years, I've been an LGBTIQ plus activist, and I participate as an activist of the debate about the equal marriage law and gender identity law in Argentina, but also assisted reproduction and comprehensive response to HIV, among other laws. From 2015 to 2019, I served as Undersecretary for Sexual Diversity Policies in my province in Santa Fe, from where we promote full access to healthcare for trans people, for lesbian and bisexual women, for gay and bisexual men, in different programs. For 5 years, I was president of LGBTIQ National Federation in Argentina. That is the most important organization. We have more than 100 members all over the country. And we have more than 100 grassroots organizations all over the country. Actually, I'm vice president of the Women, Gender and Diversity Commission or Committee in the Chamber, and a member of Education, Human Rights and Freedom of Speech Commissions. From my position as a national deputy, I work today to defend many of the years that I contribute to win as an activist. That it's an important objective for me. So I'm from my seat defending a lot of things about the healthcare access, human rights, and of course LGBTIQ rights.
Thank you for all your work, and thank you for joining us as well. Angela, going back to you, can you give me an overview on how the COVID-19 pandemic affected gender equality, especially in regards to health matters?
Yeah, I think it's really important to also talk about like that we are far away on the achievement on the sustainable development goals, and this is also like in relation to COVID-19 pandemic, but also to the increasing inequalities that we have seen after and during the pandemic also. We see that the global life expectancy and healthy life expectancy have both regressed to the level a decade ago, and that's really worrying. We should be very worried about it. And this regression is mostly associated to the inequalities that we faced during the pandemic. Gender inequalities, inequalities on access into healthcare services, the poverty that was increased. And these challenges pose a lot of pressure to the health system. And for example, if we are analyzing the Sustainable Development Goals in gender equality, we can currently see that the reports indicate that at the current pace that we are working and in the investment, the level of investment that we are putting that is not much. We at least need 300 years to end child marriage, for example, and another 286 years to close the gaps in legal protection and the removal of discriminatory laws, for example, for women and girls. So we see that we are quite far away from reaching the gender equality and the SDGs related to health. And as we see also from the effects of the COVID-19 pandemic, with the closure of schools and childcare facilities, for example, women also took on a significantly higher share of unpaid care responsibilities and also taking care of other family members during the lockdown time. And that this added a specific burden, limiting their ability also to participate in the labor market and pursue economic opportunities, which exacerbated also the pre-existing gender inequalities that were before the pandemic. And we also know that women and girls face increased barriers to accessing health services due to socioeconomic, geographic, ethnic, gender considerations. And this was also visible and is still visible when we try to access healthcare services for HIV, tuberculosis, malaria, and other diseases. And this was not an exception during the COVID-19 pandemic, which is still present. I think it's also important to consider that gender-based violence increased during the pandemic, with lots of several reports of domestic and gender-based violence surging during the time of the pandemic. And this continues to be a global pandemic. Gender-based violence is considered and has to be a pandemic because it's affecting every woman, it's affecting every girls in the different countries all over. I think it's important to also analyze how all these parameters were conducting to be affecting the gender responsive and transformative policies that probably we were having in place. And there's, of course, a lack of investment that was put into these policies to keep on working for gender equality and sustaining also the gains and the needs of the diversities, of gender diversities during pandemic and afterwards, of course. I think one critical aspect that we should be talking about also is the access to vaccine and healthcare services, knowing that there were significant challenges during the pandemic and that some lessons learned that we definitely need to take into consideration for addressing future pandemics and the current ones, of course, because we have not yet still developed, for example, an HIV vaccine, and then we need to keep on developing other vaccines, for example, for tuberculosis. We know that currently malaria vaccine is in place, trying to transform how this epidemic responses, but it's absolutely necessary to think about equality, equity, access to this innovation and tools, which are absolutely important to address gender inequalities. We know that also all the data that we have collected for the years and during the COVID-19 pandemic, specifically those in low and middle income countries. We know that there are barriers to vaccination due to socioeconomic constraints, gender norms, taboos, and lack of information. So this is really key when we talk about gender inequalities or inequalities as a whole. And as I said, I think it's really important for us to analyze all these aspects of the greatest impacts that the pandemic had on social aspects, economic and political ones that are affecting the diversities and gender diversities to participate and meaningfully engage also in the process of decision making around their own health, around our own health, but also how important it is for us to keep on advocating with gender-based information and data and key points on how we really can move forward to address the current pandemic, I will say the current epidemics we have in the world, and prepare positively, and we'll be ready for the next ones.
Definitely. Thank you very much, Angela. And in your case, MP Esteban Paulón, how did you see the impacts of COVID-19 on gender equality? And maybe more specifically, you can highlight the impacts on LGBTQIA plus population as well.
Yeah, yeah, for sure. The COVID-19 pandemic undoubtedly severely affect all the entire world population. But the impact for all the people is not what it wasn't by the same way, because
Sure.
groups whose rights have been violated, vulnerable population, including LGBTIQ plus people, particularly suffer the effects of COVID-19 in several ways. I try to identify some concrete impacts in our population. On the one hand, the compulsory isolation measures that were carried out in several countries, which affect the mobility and socialization of many people, but had an impact on LGBT, especially on LGBTIQ plus youth, forced to remain in their homes, which are often the main sources of violence and discrimination, due to the lack of understanding of the part of the fathers, mothers, and affected environment of the process for the in their process of dissident sexuality expression. The loss of space of socialization and freedom has led to an increasing situation of depression, and according to the record of social organizations in our country, especially in Latin America, there have been an increasing case of suicides and self-harm. Secondly, for transgender population, specifically, most of whom are engaged in sex work, the government measures expose them to a large number of situations of institutional violence, police, army, and other forces and police abuses led to a decrease in their work activity and therefore expose them to gather poverty and lack of food and basic goods. In addition, the lack of recognition of transgender and transvestites rights in most of South American countries and states mean that they were unable to access the various social programs that the government spent for the people and were implemented to mitigate the impact of the crisis. Other important aspect. It is well known that HIV is more prevalent in LGBTIQ population. We have, especially in trans population and gay men, we have a more prevalent HIV than in other populations. The closure of health services, or maybe the refocus of this service,
Mhm.
especially in COVID-19, and the difficulties in accessing medication, testing, vital loads, and adequate medical care were also one of the factors that had a strong impact on our community. Another aspect, it should also be noted that are a result of stigma and discrimination, LGBTIQ population are more exposed to informal employment and income instability. In many countries, it is LGBTIQ people who are engaged in jobs like hairdressing, street vending, urban waste collection, among others. Isolation measures also hit hard there. And another aspect that I think it's important, that it has a great impact on the community, is linked to human mobility. Many LGBTIQ people move feeling, flying situations of violence and discrimination, sometimes within their own countries and sometimes to other countries. The restriction of mobility has had a negative impact on the human rights to seek a new life destination in which to live freely and openly one's affectivity and sexuality. Finishing this reflection, as with HIV, the coronavirus was not limited to key populations, but ended up affecting the general population. Trans hatred and homo hatred were and still are serious obstacles to responding to HIV. In the case of the coronavirus, xenophobia too. The response to the pandemic must be based on science and evidence, not prejudice. discrimination, and prejudice are proven to undermine the conditions for full citizenship and the impact on many social and community levels, particularly exposing these groups to the effects of pandemics. Health is a human right and therefore cannot be subject to the arbitrariness and greed of markets. The guarantee of human rights of all people is fundamental and must be transversal to any response to the pandemic. Public policies are also essential to address the inequality experienced by LGBTIQ people. We need states to invest in public health, scientific research, and policies that guarantee human rights.
Definitely. Thank you very much for sharing. Based on that, I wanted to ask you, from all the issues that you've mentioned, what are the most critical effects that we still face today, now that the pandemic is over? Maybe Angela, I'll go first to you.
Yes, I think it's very critical to also like understand and it seems that the pandemic is over, but it is probably considered not longer considered an emergency of public health concern according to the WHO like regulations. However, the COVID-19 virus is still circulating, and there's
Definitely.
emerged of new um, variants that can constitute probably in the future, hopefully not, new emergencies, and then we need to keep on track and keep on need to positioning the importance of what we have learned during this time around pandemic preparedness and response. And I think it's really important also to know that governments and health organizations currently need to put more attention and focus on long-term management strategies for pandemic prevention, preparedness, and response. And this includes, of course, campaigns, vaccinations, monitoring the different variants that can circulate, and address the inequalities that are existent to access healthcare services and to guarantee the right to health for all the population. I think for COVID-19 specifically, I think there's a lot of work still to be done regarding the long effects of long COVID, which it's currently one of the major health issues. And as I was saying before, I think it's really important to keep on a look because there are still gaps and gender inequalities that we have not been able to address. We as a world are far away on track on these targets, on these goals, on these activities, and we need to fully invest on addressing these structural inequalities. I think it's really key to also know that there's a need to timely guarantee the citizen participation and civil society engagement as a right and also a tool to channel the engagement and the contributions, for example, of women in all diversity into the formulation, the development, also the execution and the monitoring of global health instruments like the current pandemic treaty. And it's also really important that we highlight the essential role of civil society and how women have contributed also during the history of pandemic responses in strengthening health systems, and how communities have also like supported a lot in the community health system strengthening, knowing that they were probably also many of us were in the first line of the response. It's also really important to consider that women currently represent around 70% of the global health and social workforce, and therefore there's a lot of work still to be done into the equal rights of participation, the equal labor rights, and also how to address this inequality that currently exists in the healthcare system also. Into another topic, I think it's important to know that there's a currently increasing challenge in financing environment for global health as a whole, and also pandemic preparedness and response should be looking forward also to be integrated into current and existing health systems and disease controlled intervention, so we can maximize the efficiency and sustainability of the responses that we are currently having and will like to have in the future. And I think around talking also about the pandemic treaty, it's really key to leverage the work that exists with governments, communities, and civil society, which is still lacking a bit of coordination and interlinks, meaning that we as stakeholders, we need to be able to reach the most affected populations all the way to the last mile of elimination of diseases, hopefully. And as we always say, leave no one behind. I think the problem of inequalities is that we are facing the lack of information, and the political will is still insufficient to invest fully and sustained in this intervention and address the current and the base of inequalities. We know that which are the causes of vulnerability. We know that exclusion and these parts of social inequalities, gender inequalities in poverty are the base of what we know currently that are affecting more the pandemic management everywhere and disease response in general. And also we know that works from our experiences also in previous disease management with HIV, tuberculosis, and malaria. And there's a lot of opportunities for us to not repeat the same mistakes around access to health services, access to innovations and tools. We know that in pandemic management, we know that no one is safe until we are all safe, and we need to keep on guaranteeing the right to health to everyone, despite origin, ethnicity, age, gender diversities. And it's really key for us to really invest on that and push a bit more on governments to be accountable on what we are doing regarding the SDGs. We are not far away from having to report on the SDGs finally, and we see that we are really far away from these commitments. So we want to see also a pandemic treaty that really reflects the needs of the communities of women and girls in the diversity of LGBTI communities that are present and who are the most vulnerable when a crisis or an emergency surges. So we really need to focus on these inequalities that we see.
Definitely. And in your case, Deputy, what are the main challenges that still remain as a more direct consequence of the pandemic in your perspective?
Yes, I want to make focus in a political level because we are living really defiant situation here in Argentina. I think one of the most critical effects that still persists of the pandemics, and I think this is a serious effect that we need to pay special attention to, is the disaccrediting of government and international institutions that are still held responsible by a significant part of the population for the isolation measures in most countries of the world. This situation, uh, one of the main consequences that have this situation have been the proliferation of authoritarian and autocratic governments, like in Argentina, negationism governments, the growth of anti-vaccine movements, and libertarian expressions which challenge the role of the state and any kind of state intervention in matters of equality, access to health, and education, and which seek to leave everything related to social coexistence to make market forces. That is, I think it's really serious that because we are thinking on a global agreement or global treated to in pandemics or pandemic agreement, global pandemic agreement. And I think if the national government still, or most of the national governments still in the position of negationism and opposite to any kind of international agreement, we are complicated for that. Obviously, also as a result of the stress that the system has undergone, there is still an impact on health service and health professionals that we have to attend. Obviously, also as a result of the stress of the system, the health system, the health professionals, and therefore people access to this right, to the right of the health. So I think if we are thinking related with the other question, if we are thinking to advance in a global agreement or global pandemic agreement, we need to guarantee the participation of civil society, because I think the population that are affected by the pandemic,
Mhm.
we have to guarantee their voices in the debate. Of course, the parliament, as you asked us, because I think that independent of the government, like in my country, the majority of the parliament is not negationist parliament, it's not anti-vaccine parliament, and it's not anti-rights parliament. We are still having in Argentina a majority in the parliament in favor of public education, in favor of LGBTIQ rights, at least till the next year elections. So we have to catch the opportunity to invite and sit in the table of the stakeholders, the parliament, the national parliaments, and of course, I think that it's important because the parliaments in every country are the institutions that have to approve something like a global agreement, at least in Argentina, by our constitution. So I think the most plural and diverse voices that we can sit in the table, in the discussion table for this global pandemic agreement is
Mm-hmm.
fundamental. I think in a challenging moment for our democracies, we need from the international institutions like WHO or another institutions, United Nations, we have the obligation um, to open the discussions, to amplify the democracy, and of course to make all the efforts that we have in our hands to to reach to reach uh, plural agreements, especially in this kind of matter, because the risk of these authoritarian and autocratic governments is to convince a majority of the society that maybe you can save alone. You have no need the cooperation or collaboration or coexistation with others. And I think that's one of the worst effects uh, before after the pandemics.
Mm-hmm.
I think the individualism it's now as a positive value in the society, and we have to recover the idea that we are one society, global society, and no one's saved alone. We need of all the people and all the countries and all the institutions to being prepared for future pandemics, because we are in a moment in a critical moment with our environment, and of course with the risk of climate change that implies maybe more common pandemics in the future. So we have the obligation to be prepared for this kind of situation.
Mm-hmm. Definitely, yeah. I think you've already mentioned the main points that I also wanted to discuss with you about the pandemic agreement, because as Angela said at the beginning, we are now or the World Health Assembly is now happening, and Unite has been in the past years and especially in the last months advocating not only for a pandemic agreement that follows the principles of transparency, equity, that includes human rights, also in a very strong and clear way, but also on, as you were exactly mentioning, on the inclusion of civil society, but also members of parliament in the discussions. So, as I mentioned in the interview that we had also yesterday, we launched this campaign called Join Your Delegation that exactly advocates for the inclusion of members of parliament in the national delegations to the World Health Assembly, also to other multilateral health forums. So we really believe that members of parliament, as direct representatives of the people, of the constituents, can advocate also for their rights and represent them in a more specific and direct way as well. And you were also mentioning the movements that we believe are also growing in every society of questioning the pandemic. questioning the efficacy of or the efficiency of vaccines. And Unite is also launching a series of posts on social media to debunking myths, or to debunk myths around the pandemic agreement specifically. But of course, it ends up touching on all the issues that you also raised. So I also wanted to share that with you and with those that are listening. So once again, as mentioned, we are all following the pandemic agreement process really closely. But in any case, I think it is really it is never enough to spread the message that we need a pandemic agreement to guarantee that these challenges that you both raised are mitigated if a new pandemic happens, and that we will be well equipped and prepared for the future. And here, members of parliament definitely play a critical role, because at the end of the day, they will be the ones also ratifying in the national parliaments this agreement, and holding governments accountable for the commitments that are made at the international level. So thank you very much to both of you for joining and for sharing your insights, and for all of you that were listening for during these two interviews on how COVID-19 affected human rights and gender equality. Thank you very much.
Thank you, Mafalda. Thank you, Unite. Count on us.
Thank you.
Thank you, Mafalda.